everybody. It's Laura with Scattered Woman here. We have a very special Faith and Family Live today. We have a special guest with us. This is Karisa Kaye of I Love Us Relationship and
Intimacy Counseling.
Thank you. I was struggling with that one for a second.
No worries.
Yes. So I'm here, Karisa is here, and we are talking today about what moms need to know, the signs and the symptoms of anxiety and depression. I know Karisa and I talked a little bit, and this time of year is just on a lot of accounts for me especially. So this one's pointed at me because I need it. But I have a feeling a lot of others of you need it as well. So we will get started here in just a second. I want to do a couple of quick housekeeping notes for everybody. We are dealing with two working women right now. So if we have phone call interruptions or child interruptions or dog interruptions, just bear with us. We are going to just have fun doing this and not worry about all the distractions and just get you the good content that you need. If you have any comments, any questions that you would like for Karisa to answer, just put those in the comments and I will be keeping track of those as we go. And that's pretty much it. So Karisa was a student leader at LeTourneau University, where I worked as a resident director several years ago. We don't need to tell anybody how old we are. It was a few years ago.
Yes.
And she graduated that first year that I was there. So we only had this brief window of being able to connect, but she was always the one that everybody on campus knew, everybody loved, and everybody looked up to because she was just this wise woman of God that led things on campus. So she's now out and doing her own thing, and I just want her to be able to throw some knowledge confetti at everybody. That's right. It's not more.
I'm good at throwing things. So, well, thanks, Laura. I appreciate being invited to speak to your audience. So I know the title says scattered woman pursuing purpose, but for the purpose of anticipating that maybe some guys might be tuned in, I'm going to try to use gender neutral pronouns today for the most part. Okay. So is it okay if I just kind of start talking about anxiety and depression a little bit?
Yeah, dive in.
All right, y'all. So I have my own private practice here in Chattanooga, Tennessee. I specialize in marriage and couples counseling as well as individual counseling as it relates to relationships, intimacy, complex trauma, and oftentimes anxiety and depression that are involved in that. Because as we know, relationships can be messy, life can be messy. Trauma usually is very messy. And so I tell people I like to work with grown-ups around grown-up things. Okay. So Laura said she wanted to have me on the show, and I thought, well, what is appropriate for this time of year that most humans can relate to? And as many of you may be experiencing right now, anxiety and depression are pretty common this time of year. The winter blues, if you will. There's less light. It's cold and dark. Everyone's kind of hibernating. You're not as motivated to get out of bed in the morning. You get in your pajamas at 5:30, maybe after work. And so I just wanted to talk a little bit about anxiety and depression today. First thing, let's see, anxiety and depression, big picture. A lot of the time when people say I struggle with anxiety or I struggle with depression, sometimes there's a stigma of shame that comes with that. And I'm really passionate about normalizing things. So hopefully this will be a normalizing and validating live feed as well, because what it means to be human is that eventually all of us are going to experience anxiety and depression at some point in life. Fair, Laura?
Very fair.
You've been going through your own stuff big time this last year.
Oh yeah.
And
right
so
there in the thick of it.
You understand that. So, so to be human means you're going to experience anxiety and depression at some point. And so what anxiety and depression tell us is that something is not as it should be. There's something off, either in our neurobiology, our physiology, our circumstances, our relationships. I'm a Christian, and so I incorporate body, mind, and soul and spirit. Sometimes things are off in our soul and our spirit. And I'll talk a little bit about that today and how anxiety and depression relates to that. But big picture, anxiety and depression just tell us that something is not where it needs to be. Okay, and then the next thing I want to talk about, we had a little image that we wanted to pull up called a window of tolerance for y'all. So I'm gonna have to use my hands because we couldn't get it involved. Okay, so window of tolerance. Windows of tolerance. If this is a chart, okay, this window right here in between my hands is your window of tolerance. That's our optimal functioning as humans. That's where I'm not too overly aroused or too under aroused, so that my brain can't function with logic and reasoning. Our window of tolerance is where our prefrontal cortex, or the front part of our brain, is operating instead of the fear center in the brain, which is in the back, our amygdala, and your we call it your mammalian brain, your survival mechanisms, fight, flight, or freeze. So your executive functioning goes on up here, and that's what is operating at its best when we're in our window of tolerance. If Laura and I are having a conversation and I'm calm and I'm not anxious or I'm not too depressed, I can approach Laura with logic and reasoning, and I can consider what Laura's saying, and I don't feel threatened, I don't feel unsafe, and we can have a nice dialogue in that window of tolerance. Make sense?
Zone.
Yeah, the zone, yes. What happens is when we are wrestling with anxiety or depression, we get either above that window, and that's where anxiety hangs out, and we call it hyperarousal. And that's when we go into fight, flight, or freeze. We have a lot of stress hormones flood our body, and we're not logical anymore. We're operating out of a fear response. We're operating out of a sense of self-preservation. I'm defensive. I'm reactive. I don't feel safe. And so I can't approach you in relationship out of a place of safety. I'm going to be very trepidatious with you. Okay.
If I'm talking to somebody and feeling like they're just like being very standoffish and just not wanting to engage, is that kind of in that zone?
We are not in the window of tolerance. We are probably hanging out up here, and we're assessing for threats, and we're figuring out how to handle those threats. That's usually what happens. And that's what anxiety does. Anxiety is fear-based. It's all about, well, we'll get into that, but anxiety is fear-based. And then below that window is your hypoarousal. And logic disappears there as well, because depression literally shuts down the prefrontal cortex in our brain as well. That's also what narcotics do and what alcohol does. It's a central nervous system depressant. And so what that means is the logical part of our brain that makes decisions on which way I should turn, right or left, mathematic equations, just reasonable, culturally acceptable norms that we choose to abide by every day, those go out the window when this part of our brain is shut down. Interestingly enough, just a side fact, that's the last part of our brain to develop. And in most adults, it doesn't finish developing until you're 25. Mm-hmm. So that's a lot of the time why teenagers make really stupid decisions, is because they don't have that reasoning part of their brain. Mm-hmm. And that's what happened. That's the part of the brain that shuts down when we're really depressed. So if you ever talk to a very depressed person, they can seem ridiculous. Like, you're like, that doesn't even make sense. Why are you thinking that? You know, I've had clients that are suicidal, and it's, oh, nobody would care if I was gone. Nobody would miss me. Yeah. Like, they just can't see logic. They don't operate in logic. It's just all of this shut down emotional part of the brain that's just numbed out, doesn't feel anything. If they do feel anything, they're really bad feelings of worthlessness, despair, hopelessness, helplessness. Does that make sense?
Oh, yeah. I told my residents for years that the guys were not worth it until they were 25 and their brains were fully developed.
Okay.
This was the thing I preached.
And even then, men are about 2 years behind, so maybe 27 to 40.
Oh, no. We won't tell them that. It'll just be depressing.
That's another discussion. Yes. So that's the window of tolerance I want us to think about as we're talking about this, because that, again, is going to be the goal for where we want to function and operate within. And things like anxiety and or depression are going to get in the way of that. And that means getting in the way of doing life well, of functioning well, of being able to go to work and do well at work, of maybe being a great mom, being a great wife, being a great friend, being a great whatever. Yeah. Mood disorders can really dampen our ability to be human and be fully present. Does that make sense?
Oh, yeah. There. I'm there.
Yeah. Okay. All right. So let me talk a little bit about anxiety. There's plenty to share about anxiety, and I took some notes, so forgive me for looking down a lot, but
no worries. They're used to me looking at my notes too.
Okay. Awesome. Okay. So what is anxiety? It's big buzzword, right? Anxiety and depression. There are a lot for people who are that watch TV often. You see a lot of the pharmaceutical companies and their antidepressants and anti-anxiety. So it's a buzzword. And so a lot of this you could find if you looked up on the internet. But I'm just going to kind of speak it out and normalize things and talk about it as a professional. So anxiety, you're afraid of something, a feeling of worry, nervousness, or unease. There's concern, apprehension, fear, or distress. Okay, so that's just an operational definition of anxiety in general. Okay, now I want to, as I'm talking about this, I want to delineate between an episode versus a disorder, because there are situations in life where people will experience an anxious episode. Maybe they've just lost a parent. Maybe there's been a major death in the family. They've been diagnosed with cancer. They just lost a job. I mean, it could be any situational stressor that presents itself, and all of a sudden they have this flood of anxiety, worry, and fear that comes in that they've not maybe ever experienced before. That would be an episode. An episode is more acute. It's not as chronic. It might be situationally dependent, but it's not as long-lasting as a disorder would be. A disorder would be abnormal behaviors for a chronic experience of anxiety, and they don't pass with time. They can spawn episodes, but they are very different than episodes. Does that make sense, Laura?
So let's take me for example. So dealing with my husband losing his job, then him being unemployed forever, my going through the cancer journey all at the same time. Those would be kind of the episode triggers.
Episodic, yes.
How long would that be considered an episode? When does it become chronic?
Okay, it can become chronic. So if it, so it just depends on what type of disorder we're talking about. Each disorder has a different diagnostic symptomology and checklist, if you will, in terms of longevity. So certain types of anxiety disorders are going to be like separation anxiety for children or adults. To diagnose somebody with separation anxiety, the kids would have to experience it for at least 4 weeks, and adults would have to experience that for 6 months or longer. Okay.
Interesting that the kids have to experience it for weeks at a time, where we would just look at our kids and say, oh, they're just dealing with separation anxiety, and it's like a little 20-minute blip.
Right. No, I mean, if it continues on, separation anxiety specifically as a disorder, if it continues on for more than 4 weeks in kids, it's diagnosed as a disorder, and you're going to want to spend time treating that and dealing with that. But with adults, it's going to be 6 months or longer. So every disorder has a different standard of diagnosing. Does that make sense?
Yeah, that's interesting. I didn't realize there were many different kind of areas.
There are different criteria for each disorder. Yep. And so there's a diagnostic statistical manual that we use as clinicians, the DSM, if some people know that verbiage. That's where you're going to find these diagnostic criteria. So did I answer your question, Laura? You said episode versus disorder?
Yep.
Okay.
I think it was good enough. I can't remember.
Okay. So the idea is if you were to remove those stressors, would that anxiety still be present?
So if the stressors are removed and there is still anxiety, then it's something deeper.
It's
more on the chronic.
More of a disorder. Yep. So like generalized anxiety disorder is you're just chronically worried about 2 or 3 things all the time. And the worry is disproportionate to the actual piece that's being worried about or stressor. Does that make sense? It's like, well, I'm really worried I'm going to fail at my job this year and blah, 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 blah. And there's nothing in my past that has ever said, I'm a failure. I'm a terrible employee. I'm unsuccessful at my work. I just chronically worry about that just because maybe I have GAD, which is generalized anxiety disorder. Does that make sense?
Yeah.
So those don't necessarily need stressors. That disorder, you almost just find reasons just to worry. Okay. Does that make sense?
Yep.
Okay. Cool. Okay. So that's the difference between an episode and a disorder. And that's something I want people to kind of be aware of as they're listening to this. Okay. So anxiety disorders, you have a number of them. I'm just going to go through them and maybe talk a little bit about them. If you have any questions, you can ask those. But again, I'm not an expert at the DSM. I don't have it memorized. So I'm going to try and try and offer as much as I can. Okay, so the first, you have separation anxiety. I mentioned that earlier. That's being separated from a loved one or an attachment figure. That's very commonly seen in children. Children that have, there's this whole attachment theory thing. Children that have insecure attachment figures that are come here, go away, or they're abandoned. They're being abandoned as children, or there's a I love you, leave me alone kind of dynamic, which is very common, unfortunately. That's going to create a lot of separation anxiety.
Yeah.
If there's a lot of trauma and there are a lot of adverse circumstances happening around the child, they're going to get it's not uncommon for children to become very clingy to whomever their secure attachment person is going to be, because it's like all of us need constancy, all of us need stability, all of us need to feel safe. And if the whole world around me is imploding, I need that one person that's my anchor. Does that make sense?
Yes. Yeah.
Okay.
We've been watching that some with some adopted kids that we've seen over the years. And
enormous with adoption. Yes, that's we could spend a whole session on that. So we have selective mutism, which is I write there? Failure to speak in certain social situations, and that's based out of anxiety. People just kind of go mute. Usually it's seen in children. It's not in all social situations, but I'm afraid for whatever reason, and so suddenly I have the inability to speak. Selective mutism. You have specific phobias. That's a persistent and excessive fear of a specific object or situation. That would be an example, like fearing heights, fearing flying, fearing animals. Does that make sense?
Yeah, so all those different phobias can fall under the anxiety umbrella.
Yep, absolutely. Yep. And there's an immediate fear response to the stimulus, and it's excessive fear, and maybe even a panic attack. Okay. Let's see. Social anxiety, that I've noticed is interestingly becoming very common. I have my own theory on that. I think so many of us we're not as comfortable relating in person anymore or face-to-face because of our electronics. Yeah. And so when we get face-to-face with people, suddenly we don't know how to behave. Thoughts?
It's just, it makes sense.
Yeah.
We are so...
Yeah. I mean, I see that even, so I work in real estate a little bit, and I coach at a gym in town. And so I see that, I mean, it takes a lot of people, it just seems like it takes people a lot more courage and bravery to just show up in person. It'd be a lot easier just to text each other, to message each other electronically. And so there's this social anxiety, as well as I think social media, honestly, has created a lot of anxiety with people and insecurity in terms of comparison and lifestyle and image. And
see that a lot with teenagers and college students.
Absolutely. Oh, yeah. And so I think people are just a lot more anxious socially anymore. And so that would be an excessive fear of becoming embarrassed or humiliated in social situations, and that ends up leading to avoidance behaviors. So people tend to isolate more or avoid. You have panic disorders, and that can be a combination of sudden panic symptoms and persistent lingering worry. You have generalized anxiety disorder, which I talked about a little earlier. That's excessive uncontrollable worry over events and potential negative outcomes.
Lots of different kinds.
Oh my gosh. Yeah, when I was researching this, I was like, holy smokes. In fact, I think there are more, don't hold me to this, but there might be more anxiety disorders than there are depressive disorders, which is interesting to me. Especially with scripture, I was told a couple of years ago that the most common command in scripture is do not fear, do not be afraid. Mm-hmm. So I think there's something to that in terms of what we're prone to. Yeah. As people, we're just prone to fear for some reason. And again, all of this, keeping in mind that this is fear-based.
So all of these different kinds, but the underlying
is fear.
Everything's based in fear.
Yes, you're being driven by fear. You're being controlled by fear. You're being driven by it. It is absolutely treatable, which is what we're going to talk about on Friday. But yes, the underlying root is I'm afraid of something. Rejection, failure, being left alone, abandonment. I mean, yeah. You have acute stress disorders, and that is after a traumatic event, something that lasts at least 3 days and up to 1 month after a traumatic experience. You have PTSD, which there's a lot of buzz about that. And PTSD really became a thing after veterans from Vietnam returned back. There was a lot of trauma work done with veterans, and they've learned a ton about PTSD by working with that generation and that population. And those are anxieties and triggers related to traumatic event, an event or events. And so, interestingly enough, they've also discovered with trauma that out of all traumas, you have neglect, emotional abuse, sexual abuse, physical abuse, mental abuse, not minimizing the importance of acknowledging all those as real. They've actually found that neglect seems to have caused the most damage for people, which is interesting because you wouldn't necessarily think that, but chronic neglect has caused more relational distress and intrapersonal distress for a person than anything else for people, because it's when you're little, we don't know how to ask for what we need. We just know that we need something. And there is a certain level of egocentrism where we believe the world does revolve around us. Yeah. And so if you don't respond to me, it must be something about me. There must be something unlovable about me. Yeah. Or something unworthy about me, or something not wanted in me, that you're ignoring me and I'm not worthy of your time, attention, feeding me, hugging me. Does that make sense?
Yeah, and we experience something like that, when we're really little, and that feels so real to us, and then we carry it with us.
Yep.
All throughout the rest of our lives and in all of our other relationships.
Yeah. And so that can create a ton of anxiety for people. I'll get into cause in a little bit, but just segueing a little bit, just trauma in general, especially neglect in relationships, can create a ton of anxiety for people because a lot of those people have identity crises. They're not sure who they are. They're not sure what they're worth. They're not sure who wants them, who doesn't want them. Do they have a purpose? Do they have an identity? Yeah. Does that make sense?
Oh, yeah.
Okay. Let's see. You have some other interesting, you have OCD. A lot of people have heard of OCD.
It's part of the anxiety umbrella.
Totally anxiety based. Yep.
Well, okay. Yeah, I guess that makes sense if you think about it as a fear-based thing.
Yep. People start to loop. We call it looping or obsessing. So they get very obsessive, and the compulsive behaviors come out as a means of trying to calm the brain down or calm the obsessive down. So my hands are never clean enough. I got to wash them again. My hands are never clean enough. I'm gonna get sick if I don't wash my hands. And so people start obsessing, and that's where they get stuck. And so it's anxiety. It's fear driven. It's treatable. It's actually very treatable. So I do want to mention that for anybody who's watching and is wrestling with OCD. That's a very treatable disorder for sure. Hoarding is actually an anxiety disorder. Yep. Okay. Yep. It's based in fear. It's that the objects, if they're removed or taken away, cause significant distress for somebody. So oftentimes people with hoarding disorders, they may have grown up poor or without a lot of socioeconomic resources. And so now that they're adults, they're going to hold on to everything they can so tightly because everything wasn't available when they were younger, or things were taken from them. Oh, yeah. Sense. And so hoarding is definitely an anxiety disorder. And I don't know if a lot of people know that. I know that they have like TV shows out there that, hoarders, and people think it's amusing and weird and crazy, but it's anxiety based. And so oftentimes hoarders not only will hold on to the things that you wouldn't think you'd want to hold on to, but they'll go out and buy more things, and it fills up their personal space. And as is true with any fear disorder, if you don't deal with it, it only gets worse. That's true of all anxiety disorders. You have to confront the fear. You have to deal with the fear. Again, we'll talk about that on Friday. But if you don't confront it, it's like this monster that keeps growing in the closet. It gets worse, and it consumes you. Yeah. So let's see. Body dysmorphic disorder. Have you heard of that one, Laura?
Yes, actually, probably as a resident director.
Yeah, sure.
We had a lot of students dealing with various things, and I think that was one that came up at one point.
Yeah. So body dysmorphic disorder, it's a preoccupation and obsession with a perceived flaw about your physical appearance. And it's to the point where it controls you. Like you're always looking in the mirror to check on, what it looks like. Oftentimes people become obsessed with plastic surgery as a means of trying to fix their perceived flaw. And they may avoid social situations because they're so afraid of people seeing X, Y, and Z. And does that make sense?
Yeah, I think what we ended up seeing was we had some students who were just obsessed with their weight. Like they were rail thin, looked like walking skeletons, but they were convinced they were fat. Is that the same thing?
No, well, I mean, a little bit, but that gets more into the eating disorder. That gets more into the anorexia and bulimia.
So
for body dysmorphia, it might be, man, my face is so square. It's so square. And my nose is so huge. And so we obsess about how huge my nose is, and I'm always looking at it, and I need to get a nose job. And even after I get a nose job, I'm not sure it's good enough. And does that make
more like a feature? It's just one feature.
Yeah, it's a feature. Yep, you got it. Let's see. Trichotillomania. That is people pulling out their hair from their scalp, their eyebrows, or their eyelashes.
Oh.
Yeah, that's actually a fairly common anxiety disorder. There's something very calming for people when they pull things out. It's like, not
just focusing on a pain instead of an internal pain.
Yep. It's kind of like cutting. Cutting actually calms some people down because it releases a type of opiate in the brain that calms people down. And so it's just like, I need to pull this out. I just need to tug it a little harder. And okay.
Interesting.
Yeah, it is interesting. What else do I have? I thought there was one more. So trichotillomania. Nope. Okay, that's it. Oh, and adjustment disorders. I'm sorry. Yeah, there was one. Adjustment disorders. So that's not uncommon. If I'm going away to college and I'm not ready to leave my parents, or I'm not really sure of myself, or I didn't have secure attachment, now I'm out on my own and I'm not really confident about who I am as a person, as a woman, it wouldn't be uncommon for me to have an adjustment disorder and have a lot of anxiety as I'm trying to adjust to my new circumstances.
It makes sense. If you're not coming from a place where you are secure and stable, trying to then go out on your own and have nothing supporting you.
Absolutely. Yep. So those are big picture. That's anxiety disorders. Okay, let me tell you just some symptoms. Obviously, according to each disorder, there's going to be some variation, but symptoms of anxiety in general for people to pay attention to. Another thing I'm really big on is I want people to be self-aware, because when the whole know thyself idea, when you know yourself, that you become a much more powerful instrument in your own life and in the lives of others. If I know my strengths and my weaknesses and my limitations and what's holding me back, that's going to make a huge difference in terms of what kind of life I lead. So symptoms of anxiety, restlessness, fatigue, and I do want to mention it's not uncommon for people with anxiety disorders to have a comorbid diagnosis, and that just means 2 or more diagnoses. It's not uncommon for people who wrestle with anxiety to also wrestle with depression. In fact, I've had some clients where we'd worked together for a couple of years, and they presented as depressed. And then once we paid more attention, because the presentation was flat, affect, real, just disengaged, not too hyped up. Well, internally, this person was just spinning out of control all the time. And so anxiety often is linked to depression, because you can only that window of tolerance, you can only live in fight or flight for so long before your body crashes. And then we go to depression, and then we cycle back up, and then we cycle back down. Does that make sense?
So that the anxiety depression dynamic,
so anxiety,
manic depressive?
Nope, that's different. That's psychosis, or bipolar. So if I'm always in fight or flight or freeze mode, if I'm always ready for war, eventually my body's going to get exhausted. I can only handle so many stress hormones, and my sympathetic nervous system being aroused and the prefrontal cortex part of my brain being shut down, I can only do that for so long. Like, God has not designed our bodies to live in that all the time. And so I will either get very sick, and thus my body and my immune system become depressed.
It's being in college and going on break and immediately getting sick.
Boom. Yes. Adrenal fatigue that's an example of the body becoming depressed, because it's like your cortisol levels and your stress hormones, they can only hang out for so long. Like, you're not supposed to be in war 24/7. Does that make sense? Like, that works for a season. If I'm in the middle of a marathon, if I'm in the middle of a basketball game, if I have to go to battle, okay, but I eventually need to go hang out and rest. I think it was Elijah in the Old Testament. He comes down the mountain running in front of the chariot. Talk about anxiety. Like, I'm trying to outrun a horse and a chariot, and then he gets down to the river, and all of a sudden he's suicidal. It's that anxiety into, ooh, I'm like so exhausted. God, just take me. Why am I even here? And God just says, just chill out, rest. And he sends angels to feed him and nurture him and love on him. Does that make sense?
Oh, yeah. Just complete overwhelm, and we crash.
Yes.
Yes.
You got it. Okay, so fatigue is really big for people who are anxious. And so, in fact, some people can get so fatigued just by sitting and thinking about something for too long that they just crawl right back into bed and they don't even go out and pursue what it is they had to pursue because they're just so overwhelmed. Yeah. That's not uncommon at all for people just to freeze up and go, I can't deal with this, I'm going back to bed. Yeah. Does that make sense?
Oh, yeah.
Oh, yeah. Oh, yeah. Oh, that human experience. Oh, yeah. Do we have we're doing okay? Any questions or anything, Laura?
No questions yet.
Okay. Let's see. Impaired concentration or mind going blank. That's pretty common. Irritability. I've noticed this a lot in gentlemen. I often find that men aren't necessarily as self-aware as ladies might be, and men are going to be less likely to ask for help. That's just kind of a fact. I mean, you talk to any physician, any therapist, they're going to have typically more female clients or patients coming in, depending on what type of physician they are. Maybe not a urologist, but for the rest of it, it's women are more likely to ask for help and be self-aware. So irritability can manifest both in men and women, big time, as far as just snappy, leave me alone. Like if you're feeling really tense before a job interview or a test and you're really worried about failing it and somebody tries to ask you for something, just explosive. Does that make sense?
Oh, yeah. My poor residents experienced that one with me at the stressful times of year a lot.
Yeah. That would be anxiety. That's anxiety. Yep.
I had no word for it at that point, but I do now.
Yeah, exactly. Let's see. Increased muscle aches or soreness. Difficulty sleeping, trouble falling asleep or staying asleep. Nausea, diarrhea, or IBS. Irritable bowel syndrome. Those are anxiety-based. Panic attacks. Adrenal fatigue. And actually, I wanted to mention early menopause is actually a thing in our culture. A lot of women are entering into menopause earlier than normal because of the chronic stress and fatigue and anxiety that we experience as a culture. Because we're always work, 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 go, go, go. Whereas, cultures like Europe or Latin American countries are much more intentional about rest and vacationing.
So the stress hormones messing with all of our other hormones and all of our systems and everything, just saying, nope, I'm done.
Yep. I mean, if you think about putting your foot on the accelerator of a vehicle, I mean, how long? I mean, you're gonna burn up your gas a lot more quickly with your foot on the accelerator than just maintaining a steady speed or maybe parking the car for a little bit. Does that make sense?
Yes.
Okay. All right. So that is kind of an overview of anxiety. Any questions on that?
Nothing so far.
Cool. All right. I'll come back to causation in a little bit. I'm going to tie in depression and anxiety and their causes at the end because there's a lot of overlap there.
Sure.
Okay. Depression. Let's talk about depression a little bit. So what is depression? There's a lot of emotional language here, feelings. Feels like there's been a loss. The way I help people understand depression is it feels like you've lost something. It could be an imagined loss or a real loss, but it just feels like something's gone, something's missing, just really sad. So if we're looking at window of tolerance, anxiety was up here, now we're down here, hypo-arousal, we're down. Okay. Feelings of severe despondency and dejection. It is actually a medical condition and a disease that negatively affects how you feel, the way you think, and how you act. Feelings of sadness, loss of interest in activities you once enjoyed, difficulty in thinking and concentration, significant increase or decrease in appetite and time spent sleeping, feelings of helplessness, hopelessness, and sometimes suicidal tendencies. So, is that pretty clear so far, Laura?
Yeah, I mean, just all I can picture are those commercials where there's the woman just kind of walking around in a daze and life is passing by and it's some depression medication commercial, but
yeah. And so there are actually a lot of really depressed Americans. A lot of we are as connected as we are with our technology and with all the resources that we have. We are one of the most depressed countries in the whole world, which I think is very. What's that?
I would buy that. Our diet does not help any on that front.
I mean, there are a number of factors that play into that we can talk
Mm-hmm.
about, but and to the point of addressing ladies, women are actually, unfortunately, we are reported to have a much higher rate of mood disorders amongst our gender than guys do, and some of it's diet related, a lot of it's hormone related, sleep related, sleep deprivation. Women need more sleep. We can talk about that on Friday, but there are a lot more women that are depressed probably than men are in this culture. So, major depression symptoms. I'll just talk about symptoms for major depression here, and then I'll talk about disorders. Depressive symptoms. There can be anxiety, apathy. I don't care. I don't care at all. I have no feelings about it. I feel numb. Like I'm just meh. I mean, hey, where do you want to go to eat? I don't care. What do you want to do today? I don't care. Those people can be very frustrating for humans that don't understand depression, by the way. If you've ever dealt with somebody who's majorly depressed, it's like, again, that logic part of the brain is gone. There's no motivation there. It's like, if you think about somebody who's high on a narcotic or has been drinking heavily, I mean, that's a similar effect. There's a general discontentment. They may feel guilt, hopelessness, loss of interest in general, anhedonia, which is a lot. They no longer find pleasure in things that they once found pleasurable. Food and sex are typically pretty common. People lose interest in that. I'm just not interested anymore. I don't care. Let's see. There are mood swings, sadness. As far as sleep, they can tend to wake up early, or they may sleep forever. They don't ever want to get out of bed. Insomnia or restless sleep. So even if you feel tired all the time because you're depressed and heavy, you still can't sleep, it's just like people get caught in this cycle. And that's true for anxiety and depression. It's like they really need sleep to calm their brain down and chill out, but they can't get it together. So as far as the body, they may be excessively hungry or not hungry at all. Loss of appetite. People go one way or the other. Fatigue or restlessness. Behaviorally, they're agitated, there may be excessive crying, they're irritable as well, and they usually socially isolate. Usually when somebody's depressed, it takes so much energy just to get out of bed. The idea of going, even if you're an extrovert, even just the idea of getting out of bed and putting on your makeup or getting dressed is like, it takes so much energy. I can't imagine going out and talking to people.
Yeah.
So that's very common for depressed people, is to kind of disappear socially. And if people don't know what to look for in depression, unfortunately, a lot of people take it personally and don't necessarily think to reach out or press in or pursue the person, but think, well, fine. If you don't want to hang out with us, fine.
Oh, yeah. Yeah. I listened to a lot of our college girls talk about that.
Yeah.
Because they just didn't understand why their friend was all of a sudden acting like this.
Mm-hmm.
And maybe it wasn't all of a sudden, they were just now noticing.
Yeah. Yeah, and unfortunately, depressed people really need people to press in and to be present and to be patient and kind of say, all right, you're not alone. We're going to do this. Cognitively, there's a lack of concentration, slowness in activity, and thoughts of suicide. Weight, there may be weight gain or weight loss. Poor appetite. They may get obsessed with certain thoughts, more looping, repetitively going over thoughts. What's the use? What's the point? No one cares. I'm all alone. I'm destined for this. Feelings of guilt, worthlessness, and I think I said helplessness. So does that make sense so far, Laura? Okay.
Yep.
Makes sense in terms of what you've seen in depressed?
Oh, yeah.
Oh, yeah. Yeah.
Yeah.
Okay, as far as depressive disorders, there are a handful I'll mention there. There's major depression, which is a lot of the symptomology that I just read off. That comes from major depression. Persistent depressive disorder is depression that lasts 2 years or longer. So major depression doesn't necessarily last for 2 years. Persistent depressive disorder does. It's at least 2 years old. And the word that people used to use for that was dysthymic, kind of like just an Eeyore.
Yeah.
Kind of like you can't ever get, there's just always a rain cloud.
Yeah. Interesting. I did not realize there was a separation between, or that major depression wasn't super long term like that.
Yeah, I mean, it can be, but as far as specifics diagnostically, it's going to look a little different. Bipolar disorder, there's a lot of misunderstanding about what bipolar is. That's very much a biologically rooted disorder, and it's the patients that or the clients that I've worked with that have been unfortunate enough to wrestle with that. It's really sad. It's really sad because they have episodes of mania where they feel like they can cure AIDS and they're going to paint the whole darn house at 3 a.m. And they may be hypersexual. I've had, a lot of affairs happen when people are in mania. And then they get into the suicidal ideation where they can't get out of bed and nobody cares if I'm here and why do I need to live? My kids would be better without me. And that can be treated with medicine. That can be treated. We'll talk about that again on Friday, but bipolar is a very real thing. And they've actually come up with a bipolar 2 and a bipolar 3 because of its long-lasting impact on their children. And you can't diagnose that until people get older. You have to be at least 18 as well. So when people diagnose kids with bipolar at age 12, it's not correct. So does that make sense?
So out of curiosity, what do you do if they're 12 and presenting with these kind of symptoms?
Well, I mean, if you're, in my opinion, a good clinician, you're going to look at the big picture. So all of us are not just biological and we're not just relational. You can do blood work on hormones, but again, when you're 12, you're being flooded with new sex hormones. And so the person, depending on gender, if a 12-year-old boy is actually like a 10-year-old boy, and depending on the young lady, I mean, are they experiencing trauma? A lot of the time, people with borderline personality disorder or intense gross trauma or abandonment issues look a lot like bipolar disorder. So sometimes medication is appropriate, but you want to be careful again because of its impact on development in the brain.
Oh, yeah.
So, but bipolar, usually if people respond to medication, you can kind of identify that bipolar is probably what's up instead of a personality disorder. Because again, borderline personality disorder and bipolar look very similar.
Interesting.
Yeah. So let's see. You have seasonal affective disorder, SAD. That's
I'm there.
We're there.
I'm there.
So tell me, I mean, feel free to share a little bit, Laura, about what that feels like for you in the winter. You don't have to.
I want to love winter because it's like cozy and warm and all the fuzzy things come out. And the other part of me just dreads January, February because it's just gray all the time.
Yeah.
I remember being in high school and having my mom tell me something to the effect of, it's the February blahs. And she was experiencing that too. And so I watched that with her. And then when I got older, was able to reflect back and be like, oh, that's what I'm doing. This makes a lot more sense now. I can deal with this.
Yes.
Knowing what was going on was huge.
Yeah. Yep. That's not a buzzword or a pop psychology thing. That's a very real condition for some people. So light and serotonin and vitamin D synthesis in women are very much connected. And so the more light women can absorb and obtain, the more positively it's going to affect their serotonin production, which is for women, estrogen and serotonin are directly correlated. That's our mood stabilizer. And so we can get into hormone stuff in a while if you want, but serotonin and estrogen are connected. And so if my serotonin is low, things are going to be out of whack. And so that's where you get things like selective serotonin reuptake inhibitors, your SSRIs, your antidepressants. And it's not uncommon for people who do struggle with SAD to use an SSRI for a few months when there's a lot of darkness. Because darkness makes people, I mean, again, if light and serotonin are directly connected, and the more light there is, the more serotonin and vitamin D synthesis, then of course I'm going to feel sad without light. And so, for example, when I lived in Maryland a couple of years ago, and I put this all together after I learned that fact, whenever I would feel upset or sad, there was this Lowe's that was right down the street. And I'd be like, I just need to go buy some cleaning products at Lowe's. I'm just going to walk around and look at some rugs. And it was so random. Well, the Lowe's there was built with taller ceilings, wider aisles. It was very bright, no matter what the weather condition was. And one day I was talking to a gentleman in the aisle, and he said, they designed this purposefully to attract women. And I said, what do you mean? And he said, the other Lowe's in town is more compact. It's darker. It's more closed in. This one they built brighter and lighter and wider, and women are just drawn to the store. And I was like, there you go. I am one of those ladies. And so it's just, and so now that I'm in real estate, it's interesting to watch, when women who, I am not all about women in the kitchen, but women who appreciate being in the kitchen, they want bright, open kitchens and living space. And that's part of that light, and it feels better, and I feel happier. Does that make sense?
Yeah. Oh, yeah. Yeah, we were ever looking at houses and I'll be like, oh, it's got skylights. Oh, it's got really big windows. Like, if I could have a sunroom in a house, I would be a happy camper.
Yes, women need light. Women need light. Yes, so sound is a real thing. Let's see, psychotic depression, that's the next disorder. Hallucinations, delusions, and paranoia are part of that. The next one, peripartum or postpartum depression. Women post-childbirth experience that, and that's a real thing. We could spend a whole hour talking about that. So postpartum depression is very important for women to pay attention to post-baby. Yeah. Premenstrual dysphoric disorder, PMDD. Some people think this is ridiculous. So I had one of my anatomy and physiology profs in college talked about when he was going to school, and how when he studied the endocrine system, they spent the first month talking about the endocrine system of men. And then the last semester, there were 2 semesters. The last part of their first semester and all of the second semester was spent talking about the hormones of women. Okay. And as a sex therapist, I can attest to the fact that women are, in fact, more complex when it comes to endocrine system, sex organs. We have more organs to deal with. We have more anatomical stuff going on down there. Guys are fairly simple in comparison to women. And so PMDD is actually fairly common in women and might go undiagnosed, but it can be feelings of intense despair. They're a lot more sensitive to rejection. They're really sad. They're really moody. They're angry. They're crying. You just can't win. You just feel like you're out of control emotionally and you have no idea. And oftentimes that happens post-ovulation up to the point of menstruation for women.
That could be a long time.
Oh, yeah, like 10 days.
You're dealing with...
Yeah, absolutely. Absolutely. And so we'll talk about how to deal with that on Friday. But that's a long time for a woman to have to suffer.
Okay.
Yeah. And then situational depression, kind of like what we were talking about earlier in terms of episodic things. Different situations arise, and then all of a sudden I'm depressed for the first time in my life, for the first time in a while. Why am I depressed? Well, I just lost this person in my life, or I'm grieving this, or it's just, as it says, situational. So does that make sense?
Oh, yeah.
Okay. Any questions so far? We're doing all right?
So good.
Okay. All right. Let's talk about causes. Not everybody cares about that, but I think it's important for people. Root causes of anxiety and depression. Mm-hmm. So I'll start. Laura, you and I were talking about this the other day. I think just the female brain, the way that our brains are wired, sets us up, unfortunately, on this side of heaven, to be a little more prone towards anxiety and depression because of how we're wired. Yeah. We don't have compartments. Men, in fact, do have compartments.
Nothing box.
We have no nothing box. So men, when their brain is at rest, it is 30% active. And when a woman's brain is at rest, it is 90% active. So it's a funny but annoying story that I hear often is when couples will go to bed together, the husband falls asleep like that, he's snoring in her ear, and she's wide awake like this, tossing and turning for, an hour and a half, trying to get over his snoring, but also trying to calm her head down. That's a pretty common scenario.
I don't try to get over it. I just kick him until he wakes up.
That works too. Shut up. Yeah, exactly.
He doesn't appreciate it as much.
Yes. So I think just the brains of women, we're just a little more prone toward, I'm going to talk about biology first and physiology. So we'll start with the brain.
Karisa, 1 second. Yeah. I'm going to flip you over to where you are the main screen for just a minute and go grab my power cord because I'm about to die in here. But you can go ahead and keep talking,
Okay.
walk through some of those root causes, and I will be right back with you.
Okay, sounds good.
There you go.
Okay, so as far as biology, there are genetic risk factors for women and men that have been documented for anxiety and depressive disorders. The heritability estimates are 30 to 67%. And so what does that mean? That means that if we have parents that have struggled with, or a generational line of people that have struggled with anxiety and depression, there's a good chance that we're going to have to do something to fight that within our own biology, which can be frustrating. That can be frustrating. You can do, and one way that I've found that people can kind of temper that out is if you're exercising, if you're eating right, if you're taking vacations, you're getting enough sleep, and you still don't feel better, chances are there's a biological thing going on there. And so it's important for people to be, in my opinion, open to the idea of medication. And you need to be smart about medication. We can talk about that on Friday, but there is a very real genetic predisposition for people to be prone towards anxiety and depression. In fact, I've met some people that it's like who they are, they're just anxious. They're just tremble. Like their bodies are just carrying around anxiety all the time. Their parents did it. Their parents did it. And so then you get into a debate about nature and nurture. They have found that parents who model anxious behaviors pass those down to their children because modeling is the most potent form of teaching people how to behave and who to become as a person. But there is that biological piece that some people are more prone towards anxiety and depression, and that's because of genetic markers or genetic manifestations as it relates to neurotransmitters and stress hormones. And so some people, for example, might genetically not be as ready to make as much serotonin as their body needs versus the person next to them that they have plenty of serotonin because their parents were physiologically fine. Does that make sense?
Yeah, it falls in line a lot with what I've been reading, because I've been doing a lot of research on gut health and healing the gut to just get me back to normal.
Yeah.
And one of the things that a doctor out of the doctor that started the GAPS diet, and I talk about the GAPS diet a lot on my page. The woman who started that, the doctor who started it, talks about how if your grandmother had this disease and your mother has this disease, and you are eating the same foods and living the same lifestyle that they lived, you're going to have it too.
Sure.
There's a genetic predisposition, but there's also, you're doing absolutely nothing different as far as how you're treating your body and what you're putting into it.
That's right. Yep.
If you are changing the way that you eat, if you're changing your lifestyle, then you have a good chance of being able to turn off that genetic predisposition and not have to deal with it.
Yep.
I am praying that for my daughter.
Good for you. Good for you. Absolutely. And that gets into epigenetics, which is the idea that certain genes are turned on or off according to situational and circumstantial stimuli. So that's a real fascinating part of genetics, I think. But let's see. I talked about genetics, our brain, sleep or lack of sleep absolutely plays a huge part. Women just need more sleep. We do. So women who don't get enough sleep are absolutely going to be more prone towards anxiety and depression because when you don't get enough sleep, you don't allow that logical part of your brain to rest the way it needs to and reboot and recharge so that you can take on the next day with logic and reason. It's going to be more based on emotion and anxiety and that mammalian part of our brain that's most primitive and instinctual in terms of functioning first.
You told me about some study when we were talking the other day. There was some study about these women who were all depressed and then they made them sleep.
Yeah. So they did. There was a study done with a group of women who were all reported to be chronically depressed. They were also chronically sleep deprived, and they were to keep as much of their routine as possible. And the only thing they were required to change as far as ruling out nuisance variables in the experiment was, I just need you to get more sleep. I need you to get 8 to 9 hours of sleep consistently and constantly for the next whatever their time period was. At the end of the experiment, no medication incorporated, nothing, no therapy, all of the women were cured of their depression because they were just sleep deprived. And I will tell you, Personally, if I go too long without sleep, I enter into despair like that. Like there's no logic. I'm overly emotional. I'm irrational. Everyone hates me. The world's falling apart. Blah, blah, blah. Why I mean, it's just a hot mess. And so go to bed. Like Scripture talks about like not going to bed angry. Sometimes you just need to go to bed. That's a metaphor. That's a metaphor. Okay. Sometimes you need to go to bed and come back to it the next day. Because again, once you get to a certain level of exhaustion, that this shuts down. It's only this. And so women need to hear that you have permission to go to bed. So we'll talk about that on Friday too. But yes, depression and sleep are very connected. What else? Hormones. Oh my gosh, we could talk for hours about hormones. If there's one thing I could go back and study and it'd be easy, I would want to be an endocrinologist now that I'm working with sex therapy issues. And your endocrine system, I mean, those little chemical messengers control everything. They control everything. And so thyroid disease, people that have thyroid disease, people with diabetes, heart disease, menopause, those people all often have big connections with an experience of anxiety. Hormones are a really big deal. Estrogen, progesterone, a lack of testosterone, all that kind of thing. What else? Biology. Trauma. I do want to mention trauma in relationship to biology because trauma changes the brain. They've shown that traumatic experiences actually do change the structure of the brain. So that gets into the discussion of neuroplasticity and the circuitry in your brain and the synapses and the axons and that myelin sheath that molds and neurons that fire together, wire together. I mean, there's all sorts of new research with neuroplasticity and changing thought patterns and thus changing the circuitry in your brain. And trauma changes the circuitry in your brain, and it changes your for example, they did a study with children that were chronically exposed to gang violence growing up and feeling unsafe. And they found that the hippocampus in each of these children was significantly smaller than those who grew up in safe conditions. Well, your hippocampus is responsible for memory and storage. And elevated cortisol levels will actually cause atrophy of the hippocampus, as well as your prefrontal cortex. So it doesn't allow certain parts of your brain to grow and thrive if I'm constantly flooded with stress hormones up here. And so trauma and biology are very connected as well. Does that make sense, Laura?
Yeah.
Cool. Okay, another source of anxiety and or depression for people, relationships, especially for ladies. We are relational to our core. And because we don't have those compartmentalization abilities, oftentimes when one of our relationships is out of whack, we're
all out of whack.
We can't relax. If I'm upset with my lover and he's upset with me, I can't function. I'm not going to work as well. If I have an issue with my parents or they have an issue with me, if I have an issue with my child or a work relationship pick a relationship. If something's off relationally for me, I'm going to have a really hard time just putting that aside and being set to task.
Oh yeah. Everything's connected and I can't just separate this one area that's driving me nuts with everything else in my world.
Absolutely true. Yep, you got it. As far as parenting, I talked about neglect earlier. Neglect can create a lot of anxiety and depression in humans as far as what they receive from their parents or their attachment figures, but also controlling parents. They have found that controlling parents actually create anxiety disorders for their children or help facilitate a development of anxiety disorders. And some of that is those parents are modeling anxious behaviors, but it's also not honoring the fact that God has designed us to become autonomous. And so depending on what culture, I'm part of a Western culture and a Caucasian culture and a middle upper class culture. And so my understanding of what health is going to be different than a culture over in India. But my understanding of healthy individuation is somebody is honored for their autonomy, and human growth and development says, okay, now you're at this stage and I'm going to give you a little more responsibility and I'm going to trust you with a little more and I'm going to honor that and I'm going to encourage you in that and I'm going to call more out of you. Does that make sense, Laura?
Yeah.
And
yes, we just got this comment from Jessica Mead. She said men have boxes and women are a big ball of wire.
Yes, that's true. That's absolutely true. I learned it as waffles and spaghetti, but yes, whatever visual works. Which is funny because most men, when you talk to them, That's what I have to be aware of in therapy, is if the wife and I start back and forth and we're tracking with each other and putting topics together, the husband oftentimes will go, wait, I thought we were talking about this. Wait, when do we leave that? We're like, well, we are, but it's connected to blah, 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 blah.
Yes.
So that's very real.
Yeah.
Are we doing okay?
Yep, we're good.
Okay. Let's see. So
we'll
trauma.
Probably try to wrap it up here pretty soon, though, because I think we're about to have a little girl come out of quiet time.
That's cool. She's ready to be part of this. Only a few more things. Okay, so relationships, I mentioned that. Being alone, being isolated, I think is a huge source of anxiety and depression for us as humans. I think there are so many people that have isolated themselves. I think our culture as Americans, we've isolated ourselves because get off my lawn and I'm independent and I'm an individual, and it's to the point where we've hurt ourselves. Now we're not living in community anymore, and so we're very isolated and sad, and we don't have anybody to reach out to when we need help.
Yeah, and we don't even live near our families a lot of times anymore.
No,
like
not tribal.
We all farm and work together, and
yeah.
That was just how it was, and it's just not anymore.
The rest of the world lives in a tribe or a community or a village, and yeah,
you have to work really hard to make one.
Yes, and it works against us over here. I think that's a huge reason. There's a lack of connection. We're designed for connection. We're designed to relate and to be in relationship with people. So let's see. People that are part of minority groups are at higher risk for anxiety. Having less access to socioeconomic resources is connected to anxiety. So people that are poor, they are typically more prone to anxiety, and that makes sense in terms of Maslow's hierarchy of needs. You know, your basic human needs to be taken care of. It's for you to feel safe and secure. Let's see. Personality types. Some people will laugh at this, but I think this is a huge thing for us. I think personality types and love languages, those are the first pieces of a person when I'm meeting them as new clients or even as friends. I want to get to know about somebody because some personality types are more prone to anxiety. Some people are naturally more highly strung than other people are. And so they're going to be a little more anxious. And some of us are more prone to depression because we feel things so deeply. So personally, I have the same personality type as Robin Williams had. I'm an ENFP, if you want to talk Myers-Briggs. And so there are, out of the 16 types of Myers-Briggs, there are 4 types that are deep feelers and big picture thinkers. And I remember one of my mentors in front of a class in grad school said, you NFs in the room, you make great therapists, but you're going to have to be extra intentional about taking care of yourself because you're going to feel everything so darn deeply. You're going to get depressed more readily. You're going to be drained more readily than somebody who might be a here and now thinker. Does that make sense? And so I think part of know thyself and self-care is going to be, you need to know your personality type because that's going to impact more. Some people are just more sensitive than other people are. Yeah. It's just the nature of the beast.
Whatever version of personality theory you want to deal with. Just figure out one you like, one you can use.
The Enneagram, the DISC, the Golden Retriever, Beaver, Eagle. I mean, yes. And then family of origin, you have things like birth order and learned patterns of behavior that impact, if I'm the firstborn and I always have to be the hero and the rescuer, and then I take that into all my other relationships in life because that's what I learned to do when I was younger, that's going to get exhausting and it's going to start feel lonely and anxiety producing later in life. So family roles, I think, as a family therapist, that's something I pay attention to with people is family of origin stuff. Existential crises are really big for people. So where do I go when I die? As a Christian, am I right with God or whatever my faith orientation might be? Am I right with my higher being, my higher power? Who am I? Why am I here? What's my purpose? All these things can really start to create anxiety for people and depression if they feel lost in any of these areas where they feel like these questions are unanswered. So
moms will deal with that one a lot.
Moms?
In that I've been, I'm a mom. My job is to take care of these kids.
Yeah.
But then, okay, I had a life before kids. What did I like? What did I do? Maybe my kids are grown. Now what do I do?
Preach.
Like we're forever trying to deal with that finding purpose piece.
Yes. Why am I here? What's existence about? Yep. And then lastly, I had, as far as the faith piece, the moral part or sin. So if I believe in the Christian faith, and I think that there's a certain standard of how to do life well and honor the Lord and honor my faith and honor people and honor Jesus. And I'm, purposefully sinning or going against the teachings and beliefs of my faith, there will probably be a level of guilt there and thus shame, and that can create a lot of anxiety and depression for people too. Shame, I mean, even using the word shame, they have found immediately makes people feel shame. The word is so powerful that people start to feel a sense of shame just by saying the word. And so if I'm living out of accordance to what I proclaim to believe and want to be about, oftentimes that can get really messy for people, and they're feeling just kind of chronically anxious or sad as well. So
yeah, that makes total sense. There's so much on
yeah, I mean,
anxiety, depression. I mean, like you had talked about before, we could talk about this on multiple topics for multiple sessions and still not really get to the bottom of it, which is why we want to jump in and really dive into what we can do about it on Friday.
Yep.
So, and correct me if I'm wrong, but we're doing this at 2:30 on Friday, correct? 2:30 Central Time.
3:30
Eastern.
Yes, my time. So yeah, we don't want to just talk about, today was about, I wanted to educate and normalize and validate what people might like, oh man, maybe that's what's going on with me. And Friday we're going to offer some solutions, because you don't have to stay stuck. Like, so you are depressed, so you are anxious, maybe you're both. There's no reason you can't get help, because there are plenty of resources out there to help. So we're going to talk about that on Friday.
Yay! Thank you so much, Karisa. This is great just to get the knowledge in there. I feel like we're having a little mini lecture series in a psychology class or something.
Yes. Yes, ma'am. Well, thanks for having me here. Yeah, thank you. I'll look forward to seeing you Friday.
Absolutely. All right, everybody, we will be back at 2:30 Central, 3:30 Eastern. My husband tells me you're supposed to flip those in TV world.
It works. Yeah.
Whatever time zone you're in,
yes,
we'll be here. And just make sure you come back and join us, and we will get the good actionable stuff ready for you on Friday. So have a fabulous rest of your Tuesday afternoon, and we will talk to you later. Bye.
Bye. Are we good, Laura?
I think so.
Those were